Depression. This is a part of the psychoeducational short series collection. The Georgia Mind Center. Remember, you deserve peace of mind. This presentation is for informational and educational purposes only. It is not intended to be used as legal, medical, or psychological advice. Although we strive to provide accurate general information, the information presented here is not a substitute for professional advice, and you should not rely solely on this information. Consult with a licensed professional before making a psychiatric, psychological, professional, legal, instructional, and financial or tax-related decision. Topics in this presentation are as follows. What is depression? How is it diagnosed? And what are the most common treatments? Depression is a mood disorder that interferes with daily functioning by impacting how the person feels, thinks, sleeps, and/or even eats. Here is what depression is not. It is not the same as having a bad or upsetting day or experiencing temporary sadness due to stressful events. Depression symptoms may consist of the following items: persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism, feelings of irritability, frustration, or restlessness, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy, fatigue, or feeling slowed down, difficulty concentrating, remembering or making decisions, difficulty sleeping, waking early in the morning or oversleeping, changes in appetite or unplanned weight changes, physical aches or pains, headaches, cramps, or digestive problems that do not have a clear physical cause and do not go away with treatment, along with thoughts of. Here are some statistics regarding depression. Approximately 21 million people in the United States experience depression. Women are twice as likely as men to report experiencing depression. And approximately 80% of adults with depression reported that it interferes with their ability to function at work, home, or social activities. Here are the common types of psychological disorders containing depression: major depressive disorder, persistent depressive disorder, perinatal depression, seasonal affective disorder, depression with symptoms of psychosis, schizoaffective disorder, and bipolar disorder. A depression diagnosis requires at least 5 depression symptoms every day for 2 weeks. There is a difference between major depressive disorder and persistent depressive disorder. This difference primarily has to do with both time and intensity. Major depressive disorder consists of symptoms of depressed mood or loss that must last for at least 2 weeks, whereas persistent depressive disorder must be present for at least 2 years. There is a difference between major depressive disorder and seasonal affective disorder. Seasonal affective disorder is triggered by changes in the season. It typically happens in the fall and winter, then subsides in spring and summer. Major depression disorder can occur in any season. There is a difference between schizoaffective disorder and depression with psychosis. With schizoaffective disorder, the psychosis remains present even when the depression is not present. In contrast, depression with psychosis, the psychotic state is typically only present when there is a depressive episode. Here are some common tools used to make diagnosis: the Diagnostic and Statistical Manual of Mental Disorders, the Patient Health Questionnaire, also known as PHQ-9, the Beck Depression Inventory, which typically measures the severity of depression, the Edinburgh Postnatal Depression Scale, and the Seasonal Pattern Assessment Questionnaire. There is hope and treatment for depression. The treatment falls into three categories: psychotherapy, which typically include cognitive behavioral therapy and interpersonal therapy, medication, and brain stimulation therapy. Brain stimulation therapy is typically explored as an option after psychotherapy and medication is found to be not effective. If you'd like to have more information or research, you can contact the Anxiety and Depression Association of America or the National Alliance of Mental Illness, or NAMI. Special acknowledgement and recognition of the source information used for the psychoeducation topic. If you or someone you know is in crisis, please call 988 for the National Suicide and Crisis Lifeline. Thank you for watching, and remember, you deserve peace of mind.